The White Bear Area Chamber of Commerce and On Location TV19 are proud to present Your Business Matters, dedicated to your business needs. The White Bear Area Chamber is a nonprofit business organization serving as an advocate for the White Bear area and its business community. Now here is the Executive Director of the White Bear Area Chamber and the host of Your Business Matters, Tom Snell.
This is Tom Snell, the Executive Director of the White Bear Area Chamber of Commerce Cable Access Television Program, Your Business Matters. And today I'm really pleased to have as our guest Joe Wavra, from OSI Physical Therapy in White Bear Lake. And Joe, thank you for coming on our program.
Thanks for having me.
Yeah. Just wanted to ask you just a few questions to start off this interview about your business. First of all, how long has OSI Physical Therapy been in existence?
OSI Physical Therapy started in 1980, so
okay.
It's an independent practice. It's owned by therapists who still currently work within the company as well.
Okay, is there any one particular owner, or was this then a group process in starting your the company?
Yeah, I might get some of the details a little off
That's
here,
fine.
But for the most part, it was started by 3 individuals, and then in recent years it's been owned by two individuals who are both physical therapists. One still practices in our Stillwater location, and then the other is more in charge of like the business side of things.
Okay, now did your company start in White Bear or in a different location?
Yeah, it actually started in Stillwater.
Okay.
Yeah, that's kind of our main hub, if you will, and that's also where some of the other business employees that are part of the company are located as well. Like their offices are there, and then they also treat patients at that location.
And you told me that your company now has 10 locations.
Yeah, I believe we're the biggest private practice in Minnesota.
That was going to be my next question.
Yeah. It's fairly large, so we're kind of proud of that. I don't know. We're up to 10 now, and like I said, they're mainly East Metro area. You know, like I said, I'm in White Bear Lake. We move up to Forest Lake down to West St. Paul, Stillwater, and we have a location at Somerset in Wisconsin as well.
Do you have any ideas why your clinic was able to grow to the extent where you now have 10 locations?
Well, you know, I'd like to say it's because we're giving quality care.
Okay.
You know, that's the best compliment we can get of being busy and needing to open more clinics because we have people wanting to come and see us.
Now, when you look at the healthcare industry today, there's lots of talk about ways to how can we economize? What can we do to provide service for healthcare rather than just provide care options? That, you know, how can we be more targeted towards getting people up, getting them so that they can get back on their feet and get to work or whatever their life experience is? How does the physical therapy industry relate to that process? And how does the physical therapy industry, do you think, take their part in helping control our expanding healthcare costs?
Yeah, that's a good question. I think, you know, what we've always tried to accomplish at OSI Physical Therapy is we like to get it in the patient's hands as soon as we can, like equip them with the tools and exercises, stretches, whatever it may be to help them manage their condition independently. So multiple things happen when we can accomplish that. They, first of all, can avoid surgery, which is obviously very expensive.
So you'll see people before, like if somebody might come to you that's got back trouble or something, and you would work with them then so that they might not need to go and have surgery.
Correct. Yeah. And you know, there's so many different injuries and things out there. And, you know, sometimes surgery is the only option, but for a lot of people, they don't know that physical therapy is another option for them. And you know, I think a lot of good surgeons or a lot of docs will, before they perform a surgery, they want you to go to physical therapy to first see if you can manage it independently first, because that's the best case scenario is obviously not to have surgery and be able to do things on your own and be able to manage it that way, which kind of comes full circle back to the healthcare cost question that you had, where you know, that we don't necessarily want to see patients for a lot of visits. Our goal is to get you in, equip you with the right things to do, figure out what it is you need to work on, and then once you're independent with that and you're improving, then we cut you loose.
I mean, have there been instances that you can think of? I'm not asking for any particular specifics, but instances where people maybe had some real debilitating back problems and you were able to get them back when they in a timely fashion where they didn't need surgery after they came to visit you, where perhaps they were thinking, I have to go and have back surgery.
Yeah, I think a good example, without getting too into details here, but you know, like for lower back problems, a lot of times those can be very debilitating. Say you're out shoveling snow or something, and you know the next morning you can't get out of bed. And so the pain is very intense, and your function decreases very significantly. But it's something that people don't realize, that you can actually manage those back problems fairly well with exercise, and a lot of them respond very well to like a home exercise program and working with a therapist.
Wow. Okay.
So there's obviously different scenarios and different types of injuries, but yeah, for the most part, you know, unless, you know, all it takes is a willingness to put in a little work and do some exercise. And I think when people are in so much pain and their function is so bad, that the last thing they think about is exercise. But we try to teach them and enable them to do stuff like that, so it helps.
Now, what separates a physical therapy option from somebody that's a chiropractic doctor, for example? What would maybe some of the similarities and then some of the areas that you're not similar?
Yeah, it's a hard question to answer, and we get it a lot too. So you know, I should be prepared to answer that. And I don't necessarily feel real comfortable talking too much about, you know, how, because we get compared to chiropractors a lot, and their chiropractors, you know, they're another great option, and I'm sure that works well. But I think if you look at it from a broad perspective, the biggest thing is, you know, we do our physical assessment. We're trying to figure out what your physical limitations are, whether it's flexibility, range of motion, strength, balance, what have you, and then we kind of have a little bit more of an exercise-based approach to treating it, where maybe in a chiropractor's practice, it's a little bit more of spine alignment, like they'll do imaging to see if there's some adjustments they can do to help you with that as well. So that's kind of big picture difference, I guess. So, yeah.
Now, is the profession of physical therapy, is it a growing profession now? I mean, are there expanded job opportunities in this field?
Yeah, it is. I think it's expanding. I mean, it's always been pretty competitive to get into physical therapy school, and I know that you know, like there's plenty of clinics like us that are expanding as well. So that means more opportunities for people that are coming out of school or looking for jobs too. So I don't have any specific data or information about, you know, specific growth numbers, but it seems to be on the rise.
Okay. Now, when a person, what type of educational background does somebody need in order to become a physical therapist? Yeah,
it's a doctorate program now. So, like even when I was in school, way back in the day, right now. So I graduated in 2003, but it was a master's at the time, and now since then, actually the year after I graduated, like our program at La Crosse, Wisconsin, turned into a doctorate program, which basically there's just a little more schooling in the area of diagnosis and pharmacology information and stuff. So, it's basically, you know, 4 years of an undergraduate degree and then 3 more years to get your doctorate.
Roughly. So it's a very honed-in experience that you have to really focus on.
Yeah, it's a lot of school, and you know, all licensed physical therapists have to kind of take a board exam to get licensed, and so it's it takes a while to get through all that, but it's worth it, and you are prepared by the time you get out of school for sure.
Great.
Yeah.
Well, we're going to take a short intermission now to go over some of the upcoming chamber events that are scheduled. Again, this is Tom Snell at the White Bear Area Chamber of Commerce. Your business matters.
Stanley, what on earth are you doing?
Well, the film is
Didn't you say you always wanted to be in pictures?
Well, yes I did, but not like this.
Stanley, it's all about television nowadays. Look at this flyer I was handed at the high school game last night. It says you too can make TV. Volunteer with On Location TV 19 and we'll show you how.
Well, Ollie, what do you think that means?
Stanley, pick up that film reel. Oh! It means that if you volunteer with On Location TV 19, you too can make TV.
Well, Ollie, what kind of TV? Oh!
If you volunteer for On Location TV 19, you can cover high school sporting events, community concerts, parades, and much more.
Do you think that's why they had cameras at the game last night?
Why, certainly. That's why they had those announcers, instant replay, and all that modern TV stuff.
Ollie, do you think that I could operate one of those TV
Why, of
cameras?
course you could. The folks at TV 19 will show you how.
Ollie, are we still living in the 1930s?
No, of course not, you silly Willy. Why'd you ask such a question?
Well, then why are we in black and white?
That's what they call special effects nowadays. I'm sure if you wanted to appear in color, all you'd have to do is ask.
Can we be in color, please?
Welcome back to Your Business Matters. Tom Snell with the White Bear Area Chamber of Commerce, and we were talking, Joe, about some of the educational venues that people have to go through that want to become physical therapists. And I want to back away from that just a little bit, and I want to ask you what would be some of the driving factors that someone might want to become a physical therapist? If I'm a senior in high school and I'm looking to see what type of profession I want to go into, and I want to help people in the medical field, why might I look at physical therapy as an area to concentrate on moving forward?
Yeah, I mean, everyone kind of has their own story as to, you know, how they ended up taking their path. But for me specifically, you know, I had a few injuries when I was playing sports in high school, so I had to have physical therapy. So that was the first time it kind of clicked. But like you mentioned too, you have to like working with people, because it's pretty much that's what you do every day, all day. Is you're working with people, and you need to be motivated by that. You know, that's what I love about my job, is that your patients motivate you, and it's very rewarding when you can help someone return to sports, or, you know, not even that, just get up and down stairs again, or just live life with less pain. So yeah, it has to be, you know, obviously you gotta like science and the human body and be comfortable with that kind of stuff where you're going to do well in any science classes, and then again, you have to be personable and like to work with people and be willing to put in the work and go to school for, like we talked about, you know, good 7 years, probably 6 to 7 years.
Now with the other question again on your type of work, as you know, there's a major transformation in the population. You know, a lot of, you know, the population as a whole is getting older, a lot older, and you've got this huge tsunami of baby boomers.
Yeah, right.
And that might mean that some of the work that one has to do in your field might change more in the future towards geriatric care and dealing with older adults.
Right.
And how does your field relate to that, and what are some of the challenges that might be faced moving forward dealing with a new group of people?
Yeah, you know, I think like OSI Physical Therapy, we treat a wide variety. I mean, OSI stands for Orthopedic Sports Incorporated, so some people, like, you know, maybe older individual maybe thinks that that's not the right place for them, but we absolutely, in fact, that's, I would say, a majority of our patients at times is, you know, older people who are active or want to stay active. You know, just because you're not a high school, college athlete doesn't mean, you know, you can't be doing the same exercises and working on the same things as others. And in fact, I'd argue that it's even more important at that stage. So, you know, we tailor our exercise programs to whatever your goals are. You know, like your first initial evaluation, that's part of it. We sit down with you and say, you know, what are you here for? What do you want to accomplish? What are you passionate about? And what do we need to work towards? And then, yeah, we kind of... Have
you worked with people that are like maybe 70 years old, or?
Yeah, I sure have. You'd be surprised at how active some people at 70 years old are, or be surprised
80?
at how... Yeah, you can keep going. I don't know what my record is, but I've been in the 90s, I'm sure, at some point in time. But, you know, again, the take-home message there, I guess, is just that you don't have to be a certain age or play a certain sport to stay active and stay healthy.
Because I know a lot of times when one thinks about physical therapy, at least me, I always think about it being related directly to some sports injury.
Right. Or if you come, we're going to torture you and make you do like
a
gladiator workout. But no, it's it's a little misconception, you know. But again, you're there, you're the patient, you know, we want to work with you and kind of, again, tailor your home exercise program and figure out a way for you to accomplish your goals.
Wonderful.
Yeah.
Are there any things particular that your physical therapy company can be separated maybe from some of the others based on the type of therapy you provide? Or are there therapies that your company has specifically come up with that are different from some of the others that might be out in the marketplace? Or are most of the therapies basically the same no matter which type of company people might go to?
That's a good question. Yeah, I think they are the same and they're not at the same. You know, every company, you know, and their therapists have a kind of a certain approach to things. For the most part, we're all trying to accomplish the same thing. But at OSI, we you know, we have a lot of specialty services. Like we have therapists who specialize in running evaluations, working with golfers. We have aquatic therapy. We also do throwing, you know, working with pitchers and throwers, where we will kind of use video analysis to specifically use that to help kind of figure out what is the problem and fix the problem. I think that's what it is. How we try to differentiate ourselves from others is that we're trying to treat and fix the problem and not just treat the symptoms. You know, so because it's one thing to come in and you can make someone feel better, but then if the pain comes back in 2 days or 2 weeks or whatever it may be, then you know, we don't really feel like we've done our job. So yeah, we're just trying to get at the root of the problem and fix that. On
the athletic area, is it primarily with people that are like in high school, or have you ever worked with anybody from like the St. Paul Saints or your company, or from some of the other more professional sports?
Right. I think I don't know for sure, but at one point in time, we did work pretty closely with the Saints. Like, I don't know if there was maybe some, you know, we had a contract where maybe we worked specifically with them, and I know I have a couple. I worked with a couple pitchers before at our clinic, so that's one thing. And we also work with a lot of you know, high school athletes as well. So the big ones are obviously White Bear Lake and Matamita and Mounds View, or you know, and all the surrounding areas. We tend to work with a lot of the athletes in different sports from those schools as well. Yeah, but no, I haven't had Tiger Woods yet or anything.
Oh, you haven't had Tiger Woods yet? Okay.
No, I'm gonna call him this afternoon actually. See.
That'd be a pretty good idea. Be a nice client to have.
Yeah, exactly. But no, we take anyone, whether you're a professional athlete or just someone who wants to stay active or just live without pain.
What are the? Is there an area that you treat them most often, most frequently? Is there like one specific area that you might want to you work with?
It kind of goes in streaks. You know, your caseload kind of fluctuates, but for the most part, you can pretty much, you know, bank on there's going to be a lot of low backs, shoulder injuries is another common one, and then also, you know, neck to knee to ankle. Those are some others, but yeah, probably shoulder and back. You know, are probably the most common.
One thing I'd kind of like to end on, and is again, it's an injury issue, but there seems to be a lot more knee replacement surgeries now, you know, and hip replacement.
Yeah.
Are there things that physical therapists can do that might be able to mitigate the need for having a hip replacement or knee replacement? Again, there's going to be a lot more of that as people get older. And
exactly. Yeah, you know, we like to help people with that. It is something that will help them if they're contemplating having a knee replacement. A lot of times people, when you introduce some specific strengthening and range of motion exercises, that will help them a lot. Now, with that being said, you know, arthritis is
That's
not,
right, you can't
no
do anything about
one's figured
that.
out how to fix that yet. So, you know, at some point in time, you know, something's probably going to have to be done, but a lot of times we can delay that for years, you know, and sometimes weeks to months, but you never know. And I think I always kind of preach to my patients to, you know, exhaust all conservative avenues first, which would be exercise and physical therapy before you go that route. So
what I'd like to say here in closing is that if somebody goes to a doctor and they have issues with lower back pain and or they're looking at the problems with their knees or their hips, before they go to the step of having surgery done, they should explore options such as physical therapy before they move forward.
Yeah, that's my belief, and I think for the most part, it's most, like, even the doctors are going to recommend that too. You know, they don't want to just rush anyone into surgery necessarily. So, yeah, it's definitely an avenue you go down first. Yeah, before you.
Well, thank you so much for coming to our program. And again, this is Tom Snell from the White Bear Area Chamber of Commerce. Your business matters.
You've been watching Your Business Matters. For more information on this program or the White Bear Area Chamber, visit www.whitebearchamber.com or call 651-429-8593.